Okay, so I'm first with 186. Facilitated diffusion, what is it? It is a form of passive transport of molecules and ions across the cell membrane via specific transmembrane or helper proteins. Insulin would be a good example of this. 187. How do the kidneys respond when someone is in shock? They respond with the renin-angiotensin-aldosterone system, where the kidneys release renin in response to a decrease in blood flow. Renin converts angiotensinogen in the liver to angiotensin 1. Angiotensin 1 travels to the lungs, where it's converted by angiotensin-converting enzyme to angiotensin 2. Angiotensin 2 then stimulates vasoconstriction, which increases blood pressure and stimulates the release of antidiuretic hormone, which stimulates the reabsorption of water from the distal convoluted tubule, and aldosterone, which stimulates the reabsorption of sodium from the distal convoluted.
So let's stop there. I've been waiting for that answer now for 7 weeks. Give him a hand.
Thank you.
How many points is that worth on the test?
So, 188. What are the consequences that can occur when we intubate someone? Specifically in switching to a positive ventilation system from a negative. There's two systems that are affected. Cardiac, we have diminished preload and diminished venous return, and respiratory, where the alveoli are not evenly saturated. Small ones can be damaged and can cause inflammation, and surfactant production is decreased. 189, the ideal positioning for someone with traumatic head injury. It's a 30-degree head elevated position. 190, periorbital ecchymosis. What is it and when would you expect to see it? It is raccoonized, and it's a late sign of a basilar skull fracture. 191, the differences between the epidural and subdural hematoma. Epidural is between the dura and the skull. It's a rapid arterial bleed from the middle meningeal artery. It has a lucid interval, which is a loss of consciousness followed by a short return to consciousness, then another final loss of consciousness. Subdural is between the dura and the pia into the arachnoid space. It's slow bleeding from the superior sagittal sinus. Signs and symptoms progress slowly over days, and elderly and alcoholics are at higher risk due to their atrophied brains. Early sign of compartment syndrome is severe pain out of proportion to the injury. And I think pharmacology, I have two more. 195, blood-brain barrier, what is it, and what kind of medications does it block? It's a boundary between the central nervous system and the peripheral nervous system. It's a network of capillary endothelial cells in the brain. These cells have no pores. They're surrounded by guile or gill connective tissue. This connective tissue makes the blood-brain barrier impenetrable to water-soluble medications. So it excludes ionized medication molecules like dopamine and allows non-ionized molecules to enter like barbiturates. The correct dose of Narcan is 2 milligrams. That was 196.
Alrighty, next up is me, and I have a couple of, I got 197, bud. 197 and 204.
You're okay.
I'm good now.
You alright?
You're rinsing out of here.
Yeah. I got you the new one. Here you go.
Okay. So, I have like three questions that are mathematical, so do you guys want me to like write it up on the board on how I figured it out, or are you guys good?
I think we should be pretty good on how you get to it.
Copy that. Okay. So 197 is named to the two acetylcholine receptors of the parasympathetic nervous system, and one is muscarinic and nicotinic cholinergic receptors. 98 is you deliver 5 micrograms per kilogram of dopamine drip to a 50-year-old patient that weighs 180 pounds. Post cardiac arrest, the dopamine concentration is 1600 mics per mil. How many drips per minute will that be? So I used the awesome thing that Gary gave us yesterday to kind of cheat and So I came up with 5.4 drips per minute,
How much again?
or sorry, 15.4 drips per minute,
Excellent.
using his cool cheat sheet that he gave us yesterday. So I did the same for the next question. This time it was 10 micrograms per kilogram on a 250-pound patient, and I got 42.75 drips per minute. Number 200, what is the dosage of lidocaine for the patient? And per Gary, was when we were going over the meds, he said a live dose is 1 milligram per kilogram. So the next one, 201, was another math equation. You deliver 2 milligrams per minute of lidocaine drip to a 62-year-old female, 150 pounds, for an episode of VTAC. The pre-mixed bag yields 4 milligrams per milliliter. How many drops? So we just did the basic drop per minute formula and came up with 30 drops per minute. And thanks to Jason, because I had a brain fart on that one, he did that.
Using a micro.
Yeah, using the micro drip set. So it's 60. So 202, the autonomic nervous system is divided into what 2 divisions? Is the sympathetic and the parasympathetic. Name 4 responses to the sympathetic nervous system. The sympathetic nervous system can accelerate your heart rate, widen bronchial passages, constrict blood pressure, blood vessels, and dilate the pupils. Then name 4 things having factors of pharmacokinetics, and I got absorption, distribution, metabolism, and excretion of the drugs. And that's it for me.
Okay, now.
Are you 205?
I am so
Get it.
Okay. So my first one's a good long one, name the 5 schedules of narcotic abuse. I assumed you didn't just want schedule 1 through 5, so,
So you don't have to tell us all, Lee, but just give us kind of some highlights of some of those
okay.
schedules.
So schedule 1, substances in the schedule have no currently accepted medical use in the United States and lack of accepted safety for use under medical supervision or high potential for abuse. Schedule 2 is substances in this schedule have high potential for abuse, which may lead to severe psychological or physical dependence. Schedule 3, substances in this schedule have a potential for abuse less than substances in 1 and 2, and abuse may lead to moderate to low physical dependence or high psychological dependence. Schedule 4, substances in this schedule have a low potential for abuse relative to substances in Schedule 3. Schedule 5, substances in this schedule have a low potential for abuse relative to substances listed before and consist primarily of preparations containing limited quantities of certain narcotics. 206, what are the 6 rights of medication administration? Hopefully everybody knows this. Right patient, right route, right med, right time, right dose, right documentation. What is affinity? Affinity is the ability of a drug to bind to a receptor. Then efficacy is the relationship between receptor occupancy and the ability to initiate response to a molecular, cellular, tissue, or system level. Name 3 organs of elimination: liver, lungs, and kidneys. Defined sympatholytic and sympathomimetic. Sympatholytic is antagonistic to or inhibiting the transmission of nerve impulses in the sympathetic nervous system. Sympathomimetic, producing a physiological effect or characteristic of the sympathetic nervous system by promoting the stimulation of sympathetic nerves. What is the difference between pharmacokinetics and pharmacodynamics? Pharmacodynamics is the effect the drugs have on the body, while pharmacokinetics is the study of the way in which the drugs move through the body during absorption distribution, metabolism, and excretion. Before the drug can begin to exert any effect on the body, it has to be absorbed into the body systems. What is the characteristics of alpha-1, alpha-2, beta-1, and beta-2? Alpha-1, smooth muscle contraction. Alpha-2, smooth muscle contraction and neurotransmitter inhibition. Beta-1, heart muscle contraction. Beta-2, smooth muscle relaxation, bronchodilator. What are the primary neurotransmitters of the autonomic nervous system? Norepinephrine and acetylcholine. The peripheral nervous system is made up of what two types of nerves? Somatic and autonomic.
215.
Let me take you back to 205, please. So on the 5 schedules of narcotic abuse, if somebody were to ask you which schedules as a paramedic, what are the 2 different schedules you might work off of? What would be the answer?
2 and 3.
2 and 3. I gave you 3 in terms of benzos, it's actually 4. So, schedule 4 is about benzos, and that would be the other class you use. 2 and 4 would be the ones you use.
Question on 207 as well. So what is affinity? Can we also put how attractive it is?
Gary, I had a question on 209.
209.
Sympholytic, is that the same thing as anticholinergic? Just out of curiosity. Can they be used interchangeably?
Typically not. Typically, they're 2 different things in terms of how they act. So, a sympatholytic would be what? Give me an example of a sympatholytic.
Isn't atropine a sympatholytic?
Dopamine one.
Dopamine, no. Dopamine is an emetic. So, yes, atropine is an example of that it breaks through the parasympathetic side that's in control. And starts kicking in. Anticholinergic, on the other hand, is kind of a broad list of signs and symptoms in terms of what's going on. Okay?
I thought atropine was a parasympathetic.
Yeah.
So sympatholytic, is that different or is that?
So sympatholytic is something that will break off the sympathetic side. So, yeah, you're right, atropine is probably not the best example. What would be an example of that? We talked about a different drug.
What's that?
No.
We're gonna put it back in the
No, it's an emetic, but not a lytic.
Oh, with it,
How about a little bit of adenosine, or denotar? Would be an example of it. It breaks the cycle of the sympathetic side.
So a lot of those antiarrhythmics.
Would be a good example. Yeah.
Are we ready?
Yep.
Which act established the schedule of narcotic drugs for abuse? And that is the Comprehensive Drug Abuse Prevention and Control Act of 1970. What is a medication half-life? That is the time required for the total dose of medication to be decreased by 1/2. Then 217 is which act included in the Truth in Labeling Clause on drug contents? That's the Federal Food, Drug, and Cosmetic Act of 1938. The first pass effect, it refers to the portion of medication's concentration that is lost through absorption in the liver before reaching systemic circulation. And describe what happens in the clinical trials of a new medication. These are intended to provide information on purity, bioavailability, potency, efficacy, safety, and toxicity. Depending on the results of the testing, studies can be stopped at any time. And then differences between affinity and efficacy. Affinity is the tendency of a medication to specific receptor. Stronger affinity, the stronger the bond. Efficacy, the bond of a medication to create a therapeutic effect. And 222, what receptors are found on many organs, responsible for promoting the parasympathetic nervous system, and that's muscarinic receptors.
Okay, Mike, Gary, nothing? Okay. So 223, what is potential potentiation, I'm gonna screw up these words, guys, I apologize now. Potentiation is the enhancement of one medication's effect by another. So an example is barbiturates and alcohol. 224, what is the difference between depolarizing and non-depolarizing agents, and give an example of each. When depolarizing bind to the nicotinic ACH receptor in the neuromuscular junction, it is actually an act like acetylcholine, and it opens up the sodium channels. This causes sodium to diffuse down the gradient into the cell, and an action potential occurs. When the depolarized, when depolarized, like sexacholine binds to a nicotinic ACH receptor in the neuromuscular junction, it actually acts like acetylcholine and opens up a sodium channel. This causes sodium to diffuse down the gradient into the cell, and an action potential occurs. Non-depolarizing bind to the same nicotinic ACH receptor, but they do not open up the sodium channel. They simply block the acetylcholine from binding. Acetylcholine is a depolarizing neuromuscular blocking agent, and rocuronium is a non-depolarizing neuromuscular blocker. 225, negative. 226, what is the parasympathetic, and give an example of a drug in its class. A parasympathetic agent is a drug that reduces the activity of the parasympathetic nervous system. These drugs are used to treat bradycardia and MIs, and is used to treat asthma. Atropine is in this class. What is a symptomatic agent? Is a drug that is producing a psychological effect characteristics of the SNS by promoting a stimulation of a sympathetic nerves. 228, what is the peripheral nervous system composed of? It is composed of the PNS, SMS, automatic nervous system, and the somatic nervous system, which is an ion plays a major effect in energy stores. Sodium, potassium, and calcium. And Gary, real quick question. If we put potassium for that question, would you be okay with that?
229?
Yes, sir.
No.
Okay, so all three of them?
Potassium is an anion or a cation?
Anion. Oh, no, it's a cation. Oh, so I have the wrong answer now. Okay. 230, what is the difference between the sympathetic and parasympathetic nervous system? The SNN is a fight or flight response. The PNS is almost the opposite effect. Eat and breathe. It relaxes the body. 231, name the pre-treatment drugs and their doses using RSI. Atropine, 0.5 milligrams, 3 to 5 minutes to max of 3.0. Lidocaine, dead dose is 1.5 milligrams per kilograms, and live dose is 1.0 milligrams per kilograms, and fentanyl, 25 to 100 micrograms. Done.
Obviously, there's more than three treatments, but we can just, there's 6 or 7 of those.
Oh, pre-treatment?
Yeah,
Like what?
like, Versed.
That's not a pre-treatment.
Not a pre-treatment?
Second one, right, correct?
So we talked about 3 primary pre-treatments. Remember I told you, remember I explained to you, there's a difference between pre-treatment, and then there's sedation and induction, and then there's the paralytic, okay? What are the 3 treatments, the pre-treatments that we talked about?
Fentanyl.
Nope, not accommodate.
Fentanyl.
Yes, fentanyl, lidocaine,
Atropine.
and atropine are considered pre-treatment. That you may or may not use any of them, okay? What are induction agents? What are 3 induction agents that we talked about?
Versed, accommodate, ketamine.
Yeah, and then with the paralytics, such as colon, probably the most primary ones, like rocuronium, Vecuronium as well. So specifically on three pre-treatments, that's what we talk about the most.
Are you ready? Okay. 233, which cation is most prevalent extracellular fluid? Regulate distribution of water. Sodium, most prevalent. Remember water follows sodium. 234, appropriate indication, dose, side effects for epinephrine 1 to 10,000. Indication, cardiac arrest, anaphylactic shock, severe reactive airway disease. Dose, 1 milligram repeated every 3 to 5 minutes. Severe anaphylaxis, 0.05, 0.1 milligrams. Side effects, palpitations, anxiousness, tremors, nausea, and vomiting. Epi 1 to 1,000, indication, bronchial asthma, exacerbation of COPD, allergic reactions, and peds cardiac arrest. Dose 0.3 to 0.5 milligrams IV. Side effects same as the other one, palpitations, tachycardia, anxious, headache, tremor. We have atropine, indication, hemodynamically significant bradycardia, and our organophosphate poisoning. Dose 0.5 milligrams for every 3 to 5 minutes to a max of 3.0 milligrams. The organic phosphate poisoning 2 to 5 milligrams or more, probably a lot higher than that. Side effects, palpitations, tachycardia, headache, dizziness, anxiety, dry mouth, pupillary dilation, blurred vision, urinary retention. We've got our sugar, our dextrose, 50%. Indication hypoglycemia. Our dose is 25 grams given in 50 milliliters. Side effects of local venous irritation. Morphine for severe pain. Dose 2 to 5 milligrams followed by every few minutes, 2 milligrams until pain is relieved or until we kill the respirator. Side effects, dizziness, altered LFC. Vecuronium, indication to achieve paralysis to facilitate innovation. Our dose is 0.08 to 0.1 milligrams per kilogram IV. Side effects, prolonged paralysis, hypotension, bradycardia. Then we have midazolam or Versed. Indication is pre-med for cardioversion, RSI, and acute anxiety states. Dose 1 to 2.5 milligrams per kilogram. Side effects, drowsiness, hypotension, amnesia, respiratory depression, and apnea. Then we have dopamine, tropin, indication, hemodynamically significant hypotension not resulting from hypovolemia, and symptomatic bradycardia refractory to atropine. Dose 2 to 5 micrograms per kilogram per minute. Always using the 1600 micrograms per milliliter dosage or concentration. Then we have 235, black box warning. When special problems arise with medication that may lead to death or serious injury, the FDA may require the manufacturer to post those warnings in a prominently displayed black box in the labeling material. And 236, what does stimulation of the parasympathetic nervous system result in? We gotta remember that is our feed and breathe system, results in many digestive functions, rest rehab type functions. Include decreased heart rate, decreased cardiac contractility, bronchoconstriction, secretion increase in the digestive glands, increased smooth muscle activity in the GI tract, and pupillary constriction. And 237, muscarinic receptors, what do they do? They're found in many organs throughout the body and primarily responsible for promoting the parasympathetic response. Some of the most important muscarinic receptors are found in you find them in Farm Book, page 123, I just referenced that. The big list. They include decreased heart rate, decreased conduction rate, cardiac, vasodilation, increased GI activity, bronchoconstriction, and most importantly, penis erection. I did put a winky eye in that. I didn't realize I was going to read this in front of class. I thought you'd have fun reading that yourself, but instead I'm just up here reading my thing. Don't touch me. Name the drugs that may be part of Schedule II narcotics: hydromorphone, oxycodone, morphine, fentanyl, amphetamine, methylphenidate, and secobarbital. Define onset of action in drugs. It's a time interval between administration of medicine and the first sign of its onset. Onset of action is influenced by the physical and chemical properties of the medication as well as by its route of administration. 240, what is the correct dose of succinylcholine when it would be contraindicated to administer?
1 to 1.5 milligrams per kilogram, and contraindication, the only ones listed in the book is known hypersensitivity medication. Obviously, it'd be contraindicated as a second dose, and,
What's a primer when a big time?
maybe
one that we talk about?
hyperkalemia.
Say again?
Hyperkalemia.
Absolutely.
But
Anytime-
it said, I read the whole chapter on
Yeah,
that in
I
the
know.
book, it doesn't even mention it, so.
I can't believe your book is
Yeah.
not getting into it, but that's a big one, I'm only
Yeah.
looking for it.
Let's see here, 242, succinylcholine creates success facilitations after administration. Explain what is going on with the neurotransmitters that causes it to happen. We've gone over this a couple times, but it's a depolarizing skeletal muscle relaxant. Means that it acts like acetylcholine in the neuromuscular junction, allows for muscular contraction, but unlike acetylcholine, it doesn't allow the contraction to happen again. It stays in the neuromuscular junction, prevents recurrent contractions from happening, which gives us our muscular paralysis for up to 8 minutes. What is the correct dosage of rock? 600 or 0.6 milligrams or 600 micrograms per kilogram IV bolus, followed by a maintenance dose of 1 to 200 micrograms per kilogram continuous infusion. Questions?
Questions?
Yeah.
Actually, I wanna go back to, I missed Christina's one. 229, what was the right answer again? You said you had it wrong, but what was the right one?
My computer changed.
She gave cations.
I gave cations.
We don't talk about anions very often. Gary, can you help us with that one? In energy
So
production?
we talked about several different anions, what were they? Phosphorus.
Bicarbonate.
Bicarbonate.
That's right.
Manganese?
Chloride?
And chloride.
Chloride, okay.
So we just need to name those three?
Which one is the most,
Well, which one was, plays the major
factor
factor
in
in energy source? We need to name all three, is that what you said?
Depends on how I ask the question.
But I
Phosphorus,
think
which one
that
was that?
her question said which was the most.
Major, which
Major.
anions
Major
play
effect in
major
energy
effects in
source.
energy
Yeah.
stores?
Okay, those three, gotcha.
Chloride it would be the answer to it, to that specific question.
What's the third one?
I have something to add real quick before we go to lunch.
Hang on.
We can all share our documents on MyBrady, is everybody aware? So, if we all just wanna fix whatever mistakes we found in our 10 questions and send them to whoever was the group leader, and then have them
Yeah.
upload it to MyBrady, we can all have access to all the correct questions.
But if you are the sharer and you're using a Mac, you gotta export it as a Word document, because as PC users cannot open Pages documents, but Mac users can open Word documents. So, if you don't know how to export that, and you're gonna be the person doing that, find me, because I know how to do it. What's that?
Just talk to the class president.
I'll repost ours, so you now on Mac and you can just.
You mean the superiors?
Superior.
PC master race?
Alright.
Hey, Charlie, did you do the Christmas thing?